Although evidence is still limited, previous studies suggest that vigorous activity and this brisk walking after prostate cancer diagnosis is associated with a lower risk of dying from the disease. And what we still don't know is if physical activity prior to prostate cancer diagnosis is associated with a risk or not. This is also important because there's a concern that the inverse association we saw with the post-diagnosis physical activity is partially due to reverse causation, because patients with an advanced disease may reduce their physical activity levels, especially vigorous activity. In contrast, the pre-diagnosis physical activity is not subject to reverse causation and may represent a long-term behavior. More importantly, pre-diagnosis physical activity might be associated with factors that can affect tumor aggressiveness. And walking as the most common type of physical activity is also interesting and has been evaluated in previous studies. However, it was not examined in the absence of other activities. And in this study, we are also interested in looking at the association between sitting time and risk of dying from prostate cancer. So therefore, in this large prospective cohort study, we investigated the physical activity, walking only in the absence of other activities, and the sitting time, both before and after prostate cancer diagnosis in relation to the risk of prostate cancer-specific mortality. And what we saw is men with a higher physical activity levels after diagnosis had a significantly lower risk of dying from disease compared with men with a minimum level of physical activity, which is equivalent to less than 1 hour of walking per week. And we also saw a similar beneficial association for pre-diagnosis physical activity levels, which suggests that the inverse association we saw with the post-diagnosis physical activity is not purely due to reverse causation. And we were able to evaluate walking only in the absence of other activities because approximately 40% of patients in this study reported that walking is the only form of recreational physical activity they did. And what we saw is very interesting is that men who walked 4 to 6 hours per week prior to prostate cancer diagnosis had a significantly lower risk of dying from prostate cancer. And men who walked 7+ hours per week had an even greater reduced risk. However, we didn't see any association for post-diagnosis walking only. Well, it's still too early to conclude there's no beneficial effect, and there's still limited evidence suggesting any biological mechanisms behind this finding. But a recent study conducted by a group of researchers in Harvard found that brisk walking prior to prostate cancer diagnosis is associated with more normally shaped blood vessels in prostate tumors. And the normally shaped blood vessels in prostate tumor can inhibit cancer spread in the body and may lower the risk of dying from the disease. Currently, American Cancer Society recommends cancer survivors engage in a minimum of 150 minutes moderate intensity activities or 75 minutes vigorous intensity activities per week. So our results suggest that prostate cancer patients should adhere to these guidelines for better survival outcomes, and I think physicians should consider promote adopting a physically active lifestyle to their prostate cancer patients. I think what will be interesting is to investigate the tumor characteristics in prostate cancer tumor biopsies so that we can identify potential biological mechanisms behind this finding.